Welcome back to UHN's Echo Concussion YouTube series. My name is Leslie Ruttan. I'm a psychologist practicing in clinical neuropsychology and clinical psychology. I split my time between Toronto Rehab and private practice, and I'm also a member of Echo Concussion at UHN.
Hi, I'm Robin Green. I'm a clinical neuropsychologist and scientist based at the University Health Network and Kite Research Institute, and I'm a member of Echo Concussion at UHN. Okay, so here are the key learning objectives for this talk. First, we want you to be able to name the typical prolonged cognitive and mental health symptoms and how they manifest in everyday life. Second, we want you to know the basics of assessment and monitoring of symptoms, the clinical interview, self-report tools, and when to refer for a more comprehensive assessment. Lastly, we want you to be able to describe some evidence-based approaches for symptom management. As you can see on this slide, we have crossed out the now outdated term post-concussion syndrome. We now talk about prolonged symptoms after concussion. The old term suggests a syndrome that is caused by the concussion. However, when a patient presents weeks, months, or years after a concussion, we really can't know the underlying cause of any given symptom. We don't know if a symptom was caused directly by the concussion or if it was around before the concussion. We don't know if a symptom, for example, attentional disturbance, is attributable to the organic effects of the concussion on the brain, or if the attention problems are secondary to something else, like anxiety or poor sleep. Therefore, in patients with prolonged symptoms after concussion, assessment and management is concerned with identifying and treating the symptoms, regardless of the underlying cause. Here are the common domains of cognition that are affected by concussion. They include attention and concentration, processing speed, learning and memory, both taking in and retrieving information, as well as executive function. As you can see, executive functioning includes many different capacities, some of which we've listed here, like multitasking, planning, controlling impulses, and much more. On the right side of the slide, you can see everyday life examples of these problems. For example, problems with focusing and sustaining attention might look like a person is simply zoning out. Processing speed difficulties may show up in everyday life as simply taking more time to carry out activities throughout the day. Memory problems may result in people forgetting instructions or conversations. And executive functions might show up as impatience or outbursts of anxiety, of anger or crying, swearing, not following through on things. On this slide, we're showing you the most common mental health problems after concussion. These include anxiety, depression, and post-traumatic stress disorder, which is a type of anxiety. For each of these categories, the symptoms may be affective, referring to feelings and attitudes, somatic, referring to physical manifestations in the body, or cognitive, meaning thoughts or thinking abilities. When it comes to affective symptoms, that is, feelings and attitudes, anxious symptoms may include nervousness, panic, and catastrophizing. Depressive symptoms include low mood and loss of interest, and for PhD, symptoms may include nightmares and flashbacks to the accident that caused the concussion. For somatic symptoms, how symptoms manifest in one's body or more physical symptoms, notice that there's a lot of overlap in how these symptoms manifest for all three domains. For instance, sleep disruption and fatigue show up for anxiety, depression, and PTSD. For cognitive symptoms, again, there is overlap across the three domains. And notice, of course, the overlap with cognitive symptoms we described earlier. Now that you've heard about the various symptoms, we want to introduce this concept, the vicious cycle of concussion. What is important to know is that these somatic, cognitive, and mental health symptoms can affect one another. Somatic symptoms like sleep problems or pain can cause or exacerbate cognitive symptoms like reduced attention. This can in turn cause symptoms of anxiety and depression, and those in turn can worsen somatic symptoms like sleep. Okay, so here are the basics of the screening assessment and also monitoring. It's important to use a combination of open-ended questions and yes/no questions to find out when the symptoms started and what their course was. Ask about relevant medical and psychiatric history. For example, past neurological history, such as prior brain injuries and headaches. We ask about mental health history, including medications, also hormonal issues, and so forth. It's important to inquire about a patient's support network, both family and social, and to determine the impact of the concussion on their life, for instance, for school, work, caregiving, driving, sports, social life, etc. Entails self-report assessment tools, and these will help you to initially screen a patient's symptoms. You should re-administer them each time you see your patient to monitor how they are doing. That is to check for improvement, stagnation, or in rare cases, decline. Here are some self-report tools that you can download for free for both mental health and cognition. In the event that cognitive symptoms persist after a 3-month period and other possible causes of those cognitive symptoms have been addressed, like sleep and mood, you should consider referral to a neuropsychologist. And it's important to know that remote options are available these days for assessment. Okay, Leslie, over to you for management.
Great, thanks, Robin. So returning to the vicious cycle of concussion, management is partly about preventing or breaking this vicious cycle. Patients need education about this interplay of symptoms, and they need treatment for the lowest hanging fruit, which are often the biggest driver of other symptoms. So namely sleep, mood, and pain, for example, headaches. Often treatment for any or all of these issues will help resolve the rest of the symptoms. So number one, really important to provide education early and at each appointment. This should include information about symptoms and their impact on everyday life, the wide range of causes of symptoms and the fact that there may be primary or secondary causes and even pre-injury causes. And finally, reassurance that a full recovery is expected. Number two, we want to treat the symptoms and not the etiology. So again, prioritizing the low-hanging fruit, those that are most amenable to treatment, and those that impact on other symptoms. So typically, again, headache, mood, and sleep. And then next, we want to make sure that when you recommend an intervention, that it's evidence-based. Here are some approaches to concussion symptoms that have excellent evidence behind them for assisting with cognitive and mental health symptoms, and that can treat wide-ranging symptoms. So we know that sub-threshold exercise has mounting evidence for speeding up recovery. We also know that even outside of concussion, exercise has positive impacts on mental health and cognition. Cognitive behavior therapy also has a great track record of evidence for treating mental health symptoms in the context of concussion, as well as just more generally. CBT, we know, is good for anxiety, depression, stress, coping, sleep, and more. Mindfulness shows effectiveness for the mental health and cognitive symptoms of concussion, like depression, anxiety, stress, sleep, and attentional problems. And in addition to these therapies, there's growing evidence for other treatments like blue light therapy. Our group has developed the Concussion Education and Symptom Management, or CESM program. It's a 6-week remotely delivered program that is showing efficacy for mood, stress, anxiety, as well as quality of life, along with confidence to self-manage one's symptoms. So to sum up, symptoms are wide-ranging and may not look like concussion symptoms in everyday life. Symptoms in and of themselves can actually cause or exacerbate other symptoms. So as a result, we really want to use the interview and tools to get a baseline of symptoms and their impact, and then to monitor those over time. We want to provide education about concussion early on and continue to repeat it. want to treat the symptoms, especially those like pain, headache pain, sleep, and mood. And then finally, use evidence-based treatments. And we've also just included here a number of educational materials that you may find helpful, some for patients directly. So brain injury advice card, these can all be found in the Living Concussion Guidelines. There's both those for healthcare providers as well as patient-specific guidelines. There's also a reference here to the CESM program, if you're interested. And next, more recently, just released through the Neurotrauma Care Pathways Project, a resource library, information on PTSD in the context of acquired brain injury, as well as a navigation tool. Right now, it's specific to Toronto, but I do believe that they're working on expanding that, and that's for patients specifically to try to find resources in their community. And then finally, if you're interested in learning more about echo concussion, you can click on this link or scan the code. And we hope that you come back and watch us again. We'll continue to update things as advances in concussion assessment and management continue to emerge. Thanks so much.